so I don't forget and interrupt you earlier.
Okay, great. So yes, welcome to our panel on politics, justice, and community. It's great to see so many of you here. Today, we're going to be having 4 presentations. I'll start by introducing myself. My name is Dr. Andrew Zitzer. I'm an associate professor in the Antoinette Westphal College of Media, Arts, and Design, and I direct the Urban Strategy Graduate Program. I'm going to be joined by our 4 panelists, who I will introduce in turn when their papers come. But the general theme with the general structure for today's panel is that each panelist will have 7 to 10 minutes to present their research, and then we'll hold all questions to the end, and we're hoping to have about 15 to 20 minutes for Q&A at the end of the 4 papers. So we'll begin with a paper by Emerson, Rowe, and Abbey Glover from the College of Medicine. Emerson is a first-year medical student from the Sunshine State of Florida, where he completed his BS in exercise physiology at Florida State University and MS in medical science at University of South Florida. And Abbey is a first-year medical student from Louisville, Kentucky, and completed her BA at Rollins College in Winter Park, Florida. Their presentation is called Heat Mapping of Pediatric and Adolescent Gun Violence in an Urban Center. Is Targeted Intervention one possible solution? So take it away, Emerson and Abbey.
Oh, I'm unmuted. There we go. Thank you, everybody. My name is Emerson Rowe, and I'm with my colleague, Abbey Glover, this morning. And we're going to be talking about our research, heat mapping of pediatric and adolescent gun violence in an urban center. Is targeted intervention one possible solution? And Abbey and I are here representing St. Christopher's Children's Hospital and Drexel University College of Medicine. So over the past year, firearm violence has firmly established itself as a leading cause of death among children under the age of 18 in the United States. This distressing reality has not only resulted in escalating healthcare expenses, but has also had profoundly detrimental effects on the mental well-being of victims, bystanders, and young individuals throughout the nation. We find ourselves in a society where a previously inconceivable question has now become all too common. Does anyone here have a gun? Or perhaps even more chilling, will today be the day? These concerns are particularly pronounced in urban areas, which bear the brunt of intentionally targeted firearm-related assaults. However, it was the onset of the pandemic that truly brought into sharp focus the magnitude of the gun violence epidemic in the United States.
So just to touch on what's being done so far, there have been nationwide school programs established that have used cognitive behavioral therapy to reduce symptoms of post-traumatic stress disorder and behavioral problems in hopes to mitigate the cycle of violence among youth. There are also child access prevention laws that have been established in various states that impose a penalty on someone who fails to secure an unattended firearm. Studies have found that negligence laws where a child accesses or could potentially access a gun were correlated with reduced relative firearm fatality in children aged 0 to 14, and that states with the most stringent versions of these laws were associated with the lowest unintentional firearm fatalities. However, none of these laws are currently present in Pennsylvania. In Philadelphia, though, there has been an injury prevention program that was established in 2019, and this has been done to improve decision-making and coordination between agencies combating gun violence crises. The Firearm Homicide and Non-Fatal Injury Review teams have been examining cases of victims of violence in depth to identify patterns and actionable items for change. Healthcare providers have also been advocating for safe storage, and studies have found that the majority of adults living in households with firearms believe that clinicians should initiate discussions of firearm safety with parents. However, these programs that have been nation and citywide are not effective based on data so far. So let's look at what we mean in our urban home of Philadelphia. Using Maply.com and publicly available data from Philadelphia government sources, we created these heat maps to track the areas where these shootings take place and whether a citywide approach is the answer or whether we should focus on more gun violent dense areas. So in 2016, there were 99 total gun-related incidences of children under the age of 18. Notice where the green is. This means there's either 1 or 2 instances, And as the spots become yellow or red, the density of gun violence increases in the area. Also notice the age difference. It's mostly the 13 to 17-year-old age group with a male to female ratio of 7-1. So in 2017, there wasn't really much change. And in fact, there was one less incidence overall. However, once we look at 2018, that number rises to 120 incidences, and males and adolescents between the ages of 13 to 17 are still dominating most of these events. In 2019, there again isn't really much change, but next year the COVID-19 pandemic sets in.
So in 2020, with the onset of the pandemic, a concerning trend emerged. A significant surge in gun violence, not only in previously identified hotspots, but also in newly emerging areas. Astonishingly, there were a staggering 197 incidences reported, reflecting an overall increase of 65% compared to 2019. Notably, this marked the largest year-to-year escalation observed throughout the entire study. And alarmingly, it's becoming apparent that our youth are facing the brunt of these tragic events. An astounding 37.5% increase was recorded among our children, while adolescents experienced a staggering 70% rise. Equally intriguing is the persistence of these newly emerging hotspots in the years following 2020, highlighting the pressing need for sustained attention and comprehensive solutions to address this escalating issue. The data for 2021 reveals a further escalation in gun-related incidents, reaching a significant milestone as the number of events surges to 213, surpassing the 200 mark for the first time. This noteworthy increase underscores the urgent need for effective measures to address this concerning trend. It is also worth mentioning that a significant shift in the dynamics of these incidences is taking place, and that's with gender. In 2017 and 2018, there was an overwhelming 11-to-1 ratio of male to female involvement. However, in recent years, we have witnessed a substantial change with a notable increase in female participation. The current male to female ratio stands at 5-to-1, demonstrating a doubling of female-related incidents. This shift in gender involvement highlights the evolving nature of gun violence and the importance of understanding the underlying factors contributing to this change. It prompts us to explore gender-specific approaches and interventions to effectively combat this issue and ensure the safety and well-being of all individuals affected by gun violence. And lastly, in 2022, the last year available to us, we had the largest total recorded number of shootings at 217, with the male and female ratio at its closest point of 4-to-1. So what have we learned from this data? From 2016 to 2022, there was an increase of 63% in children aged 0 to 12, and a 126% increase in adolescents aged 13 to 17. Overall, from 2016 to 2022, there was a 119% increase in youth gun violence. So, do the current practices to prevent gun violence in a broad city sweeping manner work? And we believe no, especially in Philadelphia. So to address the sources of much of this violence, we firmly believe that the implementation of a more targeted approach focusing on the identified hotspots within our communities. It is essential to direct our resources and efforts to these specific areas to effectively combat and prevent further violence. Promising practices are currently in early stages of development, holding the potential for improved outcomes in the near future. One such initiative is the establishment of the Youth Violence Prevention Centers, or YVPCs. This data will be collected from 2021 to 2026. And these centers serve as collaborative efforts between academic institutions and the community, aiming to advance the science and practice of youth violence prevention. Through local partnerships, YVPCs work towards developing, implementing, and rigorously evaluating innovative strategies to prevent violence and create safer, healthier family and community environments for our youth. These initiatives heavily rely on data to select and implement evidence-based interventions while recognizing the influence of social and structural factors on youth violence. Currently, the YVPCs are operational in 5 cities: New Orleans, Kansas City, Ann Arbor, Boulder, and Richmond, Virginia. However, it is important to note that one limitation of this approach is the challenge of replicability, because the specific needs of each city may vary. Nevertheless, the dedication to collaborating and utilizing evidence-based interventions holds promise in effectively addressing youth violence in these targeted areas and potentially expanding the success of these practices to other communities in the future. So in conclusion, we believe that the current practices in preventing gun violence do not address the regional trends of an urban center such as Philadelphia. And we believe that the current practices are too broadly focused and need to be directed to a more hotspot focused approach. And so we'd like to express our sincere gratitude to all of you for joining us today. We extend a special thank you to Dr. Herman for shedding light on this crucial topic, which has inspired Abbey and me to delve deeper and dedicate our time to driving meaningful change. It is through the expertise and insights shared by professionals like Dr. Herman that we are able to explore innovative solutions. We would like to clarify that we have no financial agreements or affiliations with St. Chris Children's Hospital or Drexel, and the information provided regarding these institutions was purely for informational purposes, allowing us to share relevant insights and perspectives related to our discussion. Once again, we sincerely appreciate your presence and support in this collective effort to address the issue of gun violence and create safer communities for our children and youth, because together we can make a difference. And here are our references.
Great presentation, Emerson and Abbey. Thank you so much. I know I have many questions. I will hold them like everybody else to the end. But please, for our audience, do think of questions and perhaps even consider writing them down so you don't forget as we move through the 4 presentations. Our next presentation is going to be by Joe Hendrzak. Joe is currently a science teacher in an urban high school here in Philadelphia and is working towards his EDD in educational leadership at Drexel. His paper today is called Experiences with Implementing a Social Justice Capstone Project in an Urban High School. So take it away, Joe.
Thank you very much. And I'm working on sharing the screen. And one more second. If it all works, there we go. So thank you. It's a real pleasure to be here today. And my main goal, I'm going to start with what the main goal of this talk is, and it really is to inspire you. I want you to be able to walk away from our discussion today with a real tangible way to help people, because as Emerson and Abbey pointed out, I think right now in Philadelphia, the world, we need a lot of help, and people need to work with each other. So I'm going to describe how I was able to implement change by implementing a social justice capstone project in the high school, which I'm employed. And as Emerson and Abbey also pointed out, the pandemic really kind of changed the landscape of the world for us. In 2020, the world shut down, which led to social unrest, and that social unrest really changed the landscape of our city. And what I'm going to do with you today is I'm going to tell you the story of how I was able to accomplish implementing this social justice capstone project by first telling you a little bit about me and letting you know I'm not a social justice superhero. I'm not the guy that has this all figured out. I'm just kind of working with everybody else along the way to try to make a change. I'll tell you about how we came about the social justice capstone project. And lastly, I'll tell you about some of the lessons that I learned along the way, and hopefully it will allow you to become empowered and help you realize that these are things that can be implemented across any organization with any people that you choose to do it with. So a little bit about me. My first career, I'm actually a career changer. I was a biochemist at a major pharmaceutical company for 12 years coming out of college, and I turned into a teacher and a coach upon the birth of my second child. I was a stay-at-home dad. I taught community college for a couple of years, and then I realized that I really wanted to become a high school educator. So I'm currently teaching environmental science and chemistry at a Philadelphia urban high school, and I'm enrolled in the EDD program. And I realized that as I was home thinking through the pandemic and watching the world unfold the way it was, that I taught an environmental science course where we talked a lot about what was wrong with the world, but really didn't do anything to fix it. It was, we have these problems. We have problems like climate change. We have inner city food islands. There's a lot of things going on, but the kids really didn't have a pathway forward on how to make a change. And I realized that this is a space where we can implement some change and allow the guys to really connect with themselves and the community in a very real way. The main question that I was dealing with is, how was I going to do this? How was I going to inspire these young people to go out and make a change when I didn't even really know what to do at that point either? So I came across a book, Global Citizenship Education, written by Gadelli, and it was a really powerful quote. And I'm going to read that to you because it's essential. It was essential in kind of helping me change. What is needed in education for global citizenship is a coupling of the everyday and the transformative. And I firmly believe that in everyday life, there are transformative experiences that we just don't even realize as we see them. So I set off with 3 project goals. The first goal was to engage students in the topics of social justice and specifically peace education and what those mean. The second was to have them have a meaningful experience so that they can foster a sense of belonging, not just within the classroom, but also to their communities and the world as a whole. So I hit the literature and I saw a variety of examples with high school teachers and college teachers doing this type of thing. A lot of them focused on unit projects, and unit project is you teach a unit like we would teach a unit on river pollution, and you go out and you would do a project on river pollution. Some of them were linked to after school activities, service projects through the school. But I realized that there was space to do a full year-long capstone. I teach juniors and seniors, and we were all seniors at one point in high school. And as you know, seniors in May we start losing them a little bit. And I'm like, this might be a way to capture them throughout the year and really have that culminating project as the end. And I'm fortunate enough to teach environmental science where I could link it to the curriculum that we're working with. So year 1 was last year, and I was really excited to get into it. And I detailed, as you can read, I detailed a pathway forward. I said, well, we're going to write a 1-page paper, form project teams, get a proposal together, and it was a complete and utter mess. What actually happened was the main thing is everybody just wanted to raise money. And it told me a lot about where my students were coming from. It was like, well, if we raise money, we can donate money, we can do that. But it's not really it wasn't providing the experience I was hoping these students would have by going out and working with people. It's like, we can donate money and that's really important. But so I asked, what went wrong? I looked internally and I realized that I didn't maybe put as much time into the curriculum as we should have had to allow these students to explore themselves. Things like midterms derailed the December-January timeframe, and I was focused on course content. So a lot had to do with me. So I asked the students what went wrong, like what was going on. And they said they had a difficult time coming up with ideas on their own. So it was almost a little, I didn't anchor it to anything. I mean, we taught the course material, but there wasn't anything to anchor it. They said they didn't have enough time. And what was interesting, he said, my ideas polluted theirs. So as I tried to help them brainstorm, they ended up just taking my ideas and not having their own. So, okay, back to the drawing board. I needed to think about how I was approaching this again. So influenced by Sharma, letting go to let come. So I just kind of let go of control a little bit. And as an educator, it's hard to do. And even within any organization, depending upon what power structure you're in, it's tough to let go. And we tend to want to fix things. And this isn't something that can be fixed. It's something that I think needs to happen organically. So I took a problem posing approach and linked it to the Sustainable Development Goals listed by the United Nations. If you're not familiar with those are lists of goals that the United Nations says that all humans should be entitled to. And those goals are really tangible for guys to understand and girls to understand. So we went ahead and I had the students write a 1-page paper on which Sustainable Development Goal speaks to them. And this allows the students to kind of really interact with those goals. And then by November, we did the 1-page paper, formed some project teams, and I made the rule, you can't raise money. I'm like, the one thing we're not going to do is raise money. I want you to go out and I want you to do different things in the community. You can work with community groups. All proposals had to go through me, and I'll tell you some stories as we get into it. February through May, implementation, and actually now they're putting their posters together as infographics and talking about the experiences that they had. So it's a really exciting time right now because we were able to move forward, and the project proposals were phenomenal, what the kids came up with. One group of students did autism awareness. It was something close to home for them. So they went out and they wanted to work with others about that. So they educated people in the school about it. One group of students really did something that was cool. They found a distributor of healthy beauty items. And what happens is a lot of times damaged boxes, the items get just thrown out. So they were able to serve as a liaison between a local women's shelter and the distributor of the health and beauty items to make that transfer of items. We did some book drives for local schools. A couple guys worked in a community garden. We worked with groups like Phil Abundance, held a kickball tournament. Someone did a nutrition series in the school. And one group of students went out and planted cattails to preserve biodiversity. So we had a really wide range of people just going out and helping others in the community. We had a couple that we had to shoot down for obvious reasons. One group wanted to go out and deliver pizzas to homeless people, which is very endearing. But the one thing we realized as educators, you got to worry about the safety of everybody involved. So there were some oversight that needed to happen. So some lessons, and this is again directly related to what's going to happen if you choose to do this. I think if you're an educator, the anchor is important for young people. So if you're a coach or working in a school, I think linking it to academic coursework or some tangible item is important as it provides a starting point. I think one of the most important things that I learned throughout this experience is you need to allow time. Whether you're working in an organization or you're working in a school, you have to give people space to create and to discover what this means to them and provide support when you can. Failure is okay. It's okay to fail at this. There is no rule book on what is a good project, what isn't a good project. So it's really just trying to figure it out as we go. Definitely be patient, allow room for emotions. As you work in the social justice realm, it raises things within you that you might not realize. We talk to our students about the invisible backpack, and the person next to you, you don't know what experiences they have that they're not sharing. So when you're working in a social justice project, it may have an emotional toll and bring things up that you're not used to. Be kind to yourself, flexible, and open to new experiences. So this is a picture on the left of me and my two daughters. And I like to, when I was reflecting on this experience, I equate it to skiing. And if anybody's ever been skiing, you're standing on the top of a slippery mountain. It's steep. You don't know exactly what's happening. And the easiest way sometimes is to just get started with it and navigate it as you go. And when you get down to the bottom, hopefully you look back on it as an awesome experience like I did. So I'd like to really thank you for your attention today. I hope I inspired you in some way to go out and make a positive change in the world. My list of references are here if you're interested in any of the readings. And I'd just like to take time to thank you for your attention today.
Thank you so much, Joe, for that excellent presentation. I know I have definitely questions about what happens in year 3 and what comes next, but we'll save my questions along with everybody else's to the end of our presentations. So next we're going to have a presentation by Marco Santorsola, and Marco is a PhD candidate in economics, focusing on risk and uncertainty in experimental and behavioral settings. And Marco's presentation is called The Role of Risk and Trust Attitudes in Explaining Individual Energy Affordability Perception. So take it away, Marco.
Thank you so much, Andrew, for the introduction, and thank you so much for having me. I'm just going to share my screen now so you guys can see the presentation. So this is joint work with my co-authors, Andrea, Alessia, and Lea. I'm going to start to introduce this work by talking you through about the research question we have. The research question is very simple. We try to investigate the relationship between energy affordability perception and risk and trust attitudes. And I want to explain why this question and getting an answer to it is important. We all know that in the past few years, there's been lots of attention on TV about energy. The energy use has been skyrocketing in the past few years. Devices use a lot more energy. We all have a lot of devices. There's very energy intensive industries. And we all know that somehow the resources to produce this energy are limited. And especially in Europe, there's been a lot of concern about the price of energy, especially after the start of the Russian-Ukrainian conflict. But I also want to give you one very important piece of information. This piece of information is that if we take the year 2019 and we take just energy consumption by families, households, these accounted for 27% of the total energy consumption. So it is a very important chunk of consumption, which is just for family consumption. Therefore, understanding the elements that drive household energy demand is extremely important. We know from, if we look at the literature, we know that there's a lot of factors of different varieties that have an impact on those. Most scholars agree that these factors can be categorized in three different categories. We have economic factors, demographic factors, and individual attitudes and behaviors. So these individual attitudes and behavior are in particular the focus of our study. These attitudes can be either social or cultural factors, or can be in the subcategory of what we call community or social norms. Up until very recently, all the studies in the energy environmental sector have been somehow limited by having a focus on just one particular subject. But we can say that since the late 90s, these approaches have started to become more multidisciplinary, trying to transcend the traditional boundaries. In the study I'm going to introduce to you today, we explore the relationship between risk, trust, and energy affordability perception. And we do this at an individual level. The strength of this study is that as far as we know, this is the very first study to link these attitudes to the perception of energy cost. And it's also the very first study to investigate fully and deeply on energy conservation across a very wide sample of European countries. To give you a little bit of a preview of the results, they highlight the importance of trust in shaping attitudes and behaviors related to energy use and consumption. Therefore, the more trust you have, the less energy you're going to consume. This gives a suggestion to policymakers. They could devise intervention aimed to increase trust, to have a demand on energy and energy consumption. This is a particularly important result if we interpret this alongside the theory of planned behavior. We know that the theory of planned behavior is a psychological theory which has internal and external elements. If the price perception is going to be an element of it, having more trust, being somehow worried about the price is gonna decrease your energy consumption. The data we use in this study, it comes from a survey which is conducted every 2 years, conducted in multiple countries. It's called the European Social Surveys. The participants are residents in European countries. They can be EU and non-EU countries, age 15 or older. This survey is composed of fixed modules which investigate social values and attitudes, plus special modules. The special module change at every round. The round we investigate for this study is round number 8, which was conducted in 2016, which includes 2 special modules. They investigate public attitudes toward climate change, energy security, energy preferences. Me and my co-authors focus only on the EU countries and in our statistical analysis. And that's the reason why. The reason why is that being the energy sector, a very legified sector, we try to have the most consistency and the generalizability we can have. So therefore, we get rid of 4 countries which don't belong to the EU, just to have a very similar regulatory energy sector in between the sample. The sample, which is very large, it includes 24,037 observations belonging to 19 different countries. Our dependent variable of interest is just the answer to a very simple question, which was asked to the individuals. Is we believe being the question this simple is a very strong strength, because answering to it did not require any kind of particular expertise or math knowledge. The question is, how worried are you that energy is becoming too expensive for many people in your country? And the answers to this question could range were distributed on a Likert scale. It could range from 1, I'm not worried at all, to 5, I'm extremely worried about it. In this slide, we can see instead the different categories of the independent variables and their distribution. We can classify the independent variables of this study in 3 different categories: risk and trust attitudes, social values, and we also have socioeconomic variables and controls, and fixed country effects. We can see that the trust is actually composed of 2 different aspects. We have social trust, which is how much you trust other people, and we also have political trust, which is specifically how much you trust the politicians. With regards to social values, we have 5 variables instead, which are how important you believe are equal opportunities for people. Do you believe that the government should reduce income differences? Do you agree with the basic income scheme? How safe do you feel when you walk home alone after dark? And how important is it to you to be loyal to friends? So these 5 variables pretty much sum up the social norms a person abides to, we believe. Coming to our statistical analysis, what we do is we do an OLS, which is an ordinary least square regression, and we develop 3 different models. As we can see, if we go from left to right, the number of variables increases. So in the first model, we just have the risk attitude, the social attitudes, the 5 social values, and the political views. If we look at model 2, we add all the socioeconomic controls. In model 3, we also add the country fixed effects. We believe that all the variables we add are very significant because to give you just a little bit of a preview of the results, if we look at the adjusted R squared in between model 1 and model 3, the R squared actually doubles. Coming up with some interpretation of the results and conclusions, we can say that the research shows that there is a significant link between trust attitudes and how people perceive the affordability of energy. Indeed, if we look at the coefficient for the social trust and the political trust, we can see that the coefficient is negative. So the more I trust other people, the more I trust politicians, the less worried I'm going to be that energy is too expensive for too many people, which if we think about political trust, which is the one which has the highest coefficient, quite large coefficient, if we want in behavioral research, it kind of makes sense. The more I trust the politicians, the more I believe the politicians are going to care about and take care of affordability of energy for the community. The less I trust it, the less I worry about it. Why are those findings important though? The findings highlight the importance of trust in shaping the attitudes and behaviors. Therefore, give us an intuition that policies not only need to be about price, about extension of energy to communities, they also need to aim to increase trust, because increasing trust can, if we interpret this in the theory of planned behavior, can actually drive people to make more reflective, more important decisions, and actually trust more and try to adopt more environmentally friendly behaviors, trying to reduce the amount of energy they consume. Another strength of this study is the sample we use. The European Social Survey, as I said, is a very diverse sample, which includes observation for many countries, which allows to examine the phenomenon of interest across very different social, cultural, and economic contexts. This, therefore, increases so much the generalizability of these findings. And thank you for your attention. I'll be happy to take any question during the Q&A. Otherwise, you can reach to me via email or look at my website. Thank you so much.
Thank you, Marco, for an excellent presentation. I really appreciated learning more about the European Social Survey and about trust and energy usage and perceptions of price. That was really fantastic. So now we'll move on to our final presentation by Ife Albert. Ife is a second-year doctoral student in the Community Health and Prevention Department at the Dornsife School of Public Health. She got her master's in public health from Washington University in St. Louis, and she does research on the determinants of health for people that live in slums and various marginalized populations in the global South. And her talk is entitled "The Majidun Detention Center and Gross Violations of the Rights of People with Disabilities in Lagos, Nigeria." So take it away, Ife.
Thank you. I'm going to share my screen now. Okay. So hi everyone. I'm going to be talking about the Majidun Detention Center in Lagos, Nigeria, and the ways it violates the rights of people that have disabilities and the laws that justify the center's existence. I wrote this paper using findings from exploratory interviews that I conducted last year with people that have disabilities in Lagos, and then supplemented the interviews with just a review of media literature. So at least 15% of people living in Nigeria have a form of disability. That's about 29 million people nationally and 3 million people in Lagos State, where the detention center is located. About 40% of Nigerians live below the national poverty line, but that percentage jumps to 90% for people that have disabilities. The center, which is the focus of my talk today, was initially built to hold 500 people, but it currently holds at least 10,000, and almost all of them have physical or psychosocial disabilities. The government claims it's a vocational and rehab center that teaches skill acquisition and provides healthcare treatment, but this is very different from what everyone else has to say, including former detainees and the media, who say it's basically a prison. Nigeria signed and ratified multiple international human rights treaties that are being violated here, but the most significant one is the Convention on the Rights of People with Disabilities. So going into, the laws that, even though, there's a lot of violations at play here, this center is technically supported by existing national and state laws. Ironically, laws that were meant to protect the rights of people with disabilities. Two of those laws are the 2018 National Anti-Discrimination Against People with Disabilities Act and the 2011 State Special People's Law. While the bulk of both of these laws emphasize removing societal barriers people with disabilities face by improving accessibility, they both have clauses that criminalize begging, which essentially translates to a criminalization of living at the intersection of disability and poverty. So due to structural and interpersonal discrimination and ableism, people with disabilities are more likely to live in poverty. They find it very difficult to get new jobs or start their own businesses. They are more likely to lose their jobs. They are less likely to, start and complete their education because, schools are just not accessible and there's a lot of familial ableism going on. And this, limits their abilities to pursue careers that can bring them out of poverty. Poor people with disabilities are basically forced to beg against their own desires because their access to most avenues of generating income are blocked. The main justification that has been given for the anti-begging clauses in DAPDA and the Special People's Law is that they were intended to bring traffickers that target people with disabilities to justice. On the surface, this might seem reasonable because in Nigeria, people with disabilities are at particular risk of being trafficked. About a quarter of the people that we interviewed last summer were trafficked to Lagos as kids to generate money for their traffickers through begging. But, this is a ridiculous approach to say the least, as it goes against evidence-based approaches for addressing trafficking, such as recognizing that trafficking can be addressed in a vacuum and embedding anti-trafficking strategies in every policy in order to reduce people's vulnerability to being trafficked. And that, includes improving access to education and employment and addressing police corruption. These clauses also violate the non-punishment principle, which states that trafficked people or trafficked persons should not be subject to penalties for actions that were direct consequences of being trafficked. Finally, the implementation of these laws rarely results in traffickers being held accountable, since justice starts and ends with the person that has been accused of begging. Similarly, there is a National Mental Health Act that was passed earlier this year that was also meant to protect the rights of people with disabilities. And it is a vast improvement over what used to be there, which was the 1958 Lunacy Act. But this 2023 law advocates for involuntary detention as the first step instead of a last resort. It gives medical practitioners the unilateral right to limit patients' basic rights to self-autonomy, participation in decision-making, liberty as they deem fit. It also charges law enforcement officers with deciding who needs to be detained for a mental health issue and transporting them to a treatment center. It empowers these law enforcement officers to use force, and it doesn't mandate or suggest any sort of training or establish accountability mechanisms. So moving on to the experiences of people with disabilities with regard to the center itself, I'm going to start with just intake processes. The official process for people with psychosocial disabilities is that there is supposed to be a specialized rescue team that picks up people from the street that appear to have mental health issues and conducts an investigation to confirm their mental health status and find family members of friends. In reality, these investigations are not happening. There's been numerous occasions of people actively searching for their loved ones for months without knowing they were being held at the center. As for people with physical disabilities, they are picked up by these rescue team agents as they go about their daily lives and accused of begging, regardless of whether or not they were actually begging. Reports range from being dragged out of public transit to being picked up as they run errands. And that's because a primary goal of these arbitrary arrests is actually extortion. So rescue team agents accuse people with disabilities of begging and threaten them with detention in Majidun unless they give them money or prized possessions. So after people are arrested, they are brought to the center, which has its own in-house court. And that's important because this court pretty much gets to do whatever they want and they're closed off to the public. So court records are they're very difficult to access. And outsiders like journalists or even lawyers are not allowed in court. So defendants don't get to have their own lawyers. They're pretty much coerced into pleading guilty, and then they are charged a fine that is equivalent to 1 month's pay. Like if someone was making minimum wage, that would be 1 month's pay, so about 30,000 naira. And they have to pay that fine before release. There's also the issue of family separation. So when people with disabilities are arrested while they are with their children, those children are taken from them and sent to welfare centers, and then parents have to prove that their children are theirs and that they are able to financially provide for them. This can only be described as cruel because people detained for begging are unlikely to be able to prove this financial capacity to provide, and only 43% of children born in Nigeria are registered at birth, and that number is even lower for the poorest households. It's unknown how many of these parent-child separations are permanent. Within the center itself, former detainees report living in cramped, unhygienic cells, receiving very little water and food, experiencing worsened impairments, gaining new disabilities, and even seeing people die upon release as a result of illnesses they developed during detainment. So deaths from tuberculosis, sores that got infected, pneumonia, etc. Of course, mental health of former detainees drastically drops both during and after their stay, but the negative mental health impacts are not just limited to people that have been detained. Almost everybody we interviewed last summer, regardless of whether or not they had been detained before, reported living in perpetual fear of being arrested as they go about their daily activities. There's also the issue of disappearances. People have died in their cells, families were not informed, their bodies were not released. Detainees are denied visitation, and so people actually have to pay center staff if they want to see pictures as proof that their detained loved ones are still alive. Finally, even though the purported aim of institutionalizing people with mental disabilities is to treat them, actual treatment facilities within the center are incredibly underfunded and understaffed. For example, there's no resident psychiatrist, and medications are rarely available when prescribed. So to end on a high note, and I'm just kidding, unfortunately, there's no high note here. I want to point out what I think is at the crux of the injustices here, which is that there is a cycle of state-sanctioned and enacted violence happening in Lagos. So the state creates disability by refusing to address determinants of health and well-being. For example, most of the people we interviewed noted that they became disabled because of accidents, untreated illnesses, or just, experiences of violence. And then the state creates ripe conditions for institutionalization by 1, refusing to alleviate poverty, which is the main reason people have to beg in the first place, and 2, inciting or allowing events that cause distress for people with disabilities to happen. For example, empowering law enforcement agents to arrest them despite knowledge of widespread corruption and extortion. And then the state uses those conditions as evidence for criminalization and institutionalization, which in turn provides even more justification and more opportunities for state-sanctioned violence by further disabling people and further impoverishing them. I think this raises the question of why this is happening. What is the real reason underlying discriminalization of the combination of disability and poverty? And it seems to me, at least, that for the past couple of decades, the Lagos state government has placed increasing emphasis on attracting foreign and private investment as a way of increasing revenue and pursuing economic development. And it's important to note that this strategy is actually encouraged by multilateral organizations like the World Bank and the IMF. The problem with this strategy, though, is that appearance, the way things look, becomes very important. And so this is the socio-political environment in which the clampdown on begging has occurred. And it has happened alongside similar clampdowns on slums, on hawking, or other nuisances. And this is a word that has literally been used by government officials numerous times. And I think this betrays a root desire of the government, which is to render poverty and therefore disability invisible in the pursuit of development and sanitization of the state. Okay, that's the end of my presentation. Thanks for listening. Going to stop sharing now.
Thank you so much, Ife. That is a very powerful and illuminating presentation. Okay, well, we've had our 4 presentations. We have about 15 minutes left for Q&A, and I wanted to ask our audience members and our panelists if they had any questions for our 4 wonderful, amazing, generative, thought-provoking papers and presenters that we had today. So if you have a question, you can either raise your hand, you can put it in the chat, or you can raise your Zoom hand with the reactions button. I'll just give it a moment. All right, while we're waiting for folks to formulate their questions, I actually have questions for each of the panelists. And so for Emerson and Abbey, as you probably know, in Philadelphia, we just had our primaries and we are in the process of electing a new mayor, which may result in a new police commissioner as well, although that's not known yet. And so I wondered if you could put yourself in a policy position for a moment, if you had something you could tell to our next mayor and potential next police commissioner about gun violence and adolescence, what would you instruct them to be thinking about? What would you tell them to be paying attention to? Which of the interventions that you profiled would you like to see enhanced in Philadelphia?
I think, at least for me, just like from the research that we've done, better after school care programs, I think is something that's really important because kids they'll go to school and then they'll have an after school care program until about 5 or so p.m. And then if their parents aren't getting home from work until 7 or 8, there's that gap in time between like 5 to 7 p.m. where the kids just don't really have anywhere to go. And from what we've seen, a lot of gun violence stems from kids not feeling safe. And so if they don't really have a safe place to stay, they're at home, they're alone, or they're just kind of wandering around, that's going to lead to an increase in gun violence. So I think just like 1, creating safer communities, and like 2, creating programs where kids have a space to feel safe, I think is really important. I don't know. What do you think, Emerson?
I agree. I think the implementation of more programs within the areas where these incidents are occurring is huge. We actually had a panel at Drexel just last week talking about gun violence, and a lot of the students mentioned that gun violence really has no shape or designated person that it targets. And outside of just the youth that we looked at, there's so many others that are affected. So I think it comes down to making the areas where these events that take place a more habitual place where we can actually enjoy each other as a community again, because I feel like a lot of this stems from not looking at each other or viewing each other as family or friends. This used to be the city of brotherly love, and you're supposed to look at each other as neighbors and not want to do harm to each other. So I feel like if we go back to the core of what Philadelphia was brought up on, I think that's one place to start. And so just to reiterate, I would tell whoever the new person in charge would be is to kind of start focusing on the roots of what kind of made Philadelphia great back in the day.
Great, thank you to both. All right, any questions from the audience? I'll give it a moment. All right, I had a question for Joe as well. Joe, I really have to say I admire your presentation. My wife is a public school teacher for almost 20 years in the school district of Philadelphia as well, and we know how hard it is to engage students in all the complexity of that work. And so I'm grateful to you for continuing to do that. And I wonder what year 3 looks like for you, if you're planning to do this project again. And if you said failure was an option, you sort of alluded to some failures in the first year, second year got better. Are you going to be bringing it forward into the third year? And if so, what support have you gotten from your principal and from the rest of the school in helping you carry off such an ambitious project?
Yeah, so to answer your first question, we're definitely moving on with year 3 because I'm getting feedback. And I think one of the important points in the whole project is really asking students what they think about it, right? This is their project. So in talking with students and like, was this impactful for you? And it was almost across the board that everybody really enjoyed doing it and they felt like it was worthwhile. But going next year, I think I pushed it too much towards the end of the year, thinking that it was going to be a space where they could fill time and work on projects instead of, just not kind of ending the school year. I think so. What I'm going to do is I'm going to move the application part of the project more towards the third quarter earlier in the year and have the write-up do more towards the end of the year because we still have them. They are still very engaged in the third quarter. So it's like, okay, we want you to go out and we want you to physically do your project, maybe between February and April, and then the April-May timeframe kind of consolidate, write it up and allow for any stragglers. And as far as, I'm very fortunate to be in a school where we're a mission-based school. And being a mission-based school means that our administration really does look for things like social justice as a part of the curriculum. So I'm very fortunate in that sense that I'm very supported in moving forward with the initiative and finding time in the curriculum to have it done. Plus, in my school, environmental science is considered an elective course for juniors and seniors. So in being an elective course, that allows me room in the curriculum to do that versus something like chemistry, which is a state mandated course and certain things need to be covered. So I'm, again, just, from a space of gratitude, just very, very fortunate and lucky to be able to complete this project with the students that I work with.
That support is so critical. I know from secondhand experience through my wife that the support of the administration and colleagues is what makes this all possible. So that's great to hear that your school is mission-based and that there's a lot of support for you to do this within the curriculum. We did get a question in the chat for Abbey and Emerson. Did you notice a difference in accident versus premeditated or gang violence? And would that change how you approach the problem? I don't know if you were able to sort that out in your data, but I'm curious to hear what your thoughts are.
So from the literature, it's actually a very, very small percentage that in that demographic that's actually incidental violence. And then the incidental violence is more at home with kids like playing around with guns. But what it was is more so like either like bystander shootings or just like we didn't really see anything with like specifics towards like whether it was gang violence and stuff like that, because we did pull from the public database. So it's called Open Data Philly, and it like lists everything, like all the coordinates and it'll list the age, but it doesn't specifically say what kind of violence it was, but just from the literature, it's mostly not incidental. That makes up a small piece of it.
I should preface as well that the next step, this was a part of like a preliminary portion of our research. So taking the further steps in this would be going to the Philadelphia Police Department and actually being able to have access to each one of the incidences, which from 2016 to 2022, I think the total number was around 1,906 incidences. So going through each one of the files would take a while. However, it would provide more data talking about whether it was incidental or homicidal nature or target. So furthering the research that we're doing would be part of distinguishing whether or not these were targeted or not.
Yeah, that makes a lot of sense. And I could see also you potentially interviewing folks who've been impacted directly, as well as interviewing folks from the police office and find out how they were all sort of, affected by gun violence and what solutions they might see and what were the circumstances that surround it. So I could see focus groups, I could see interviews, I could see a lot of rich qualitative data collection potentially in the future of this project. I have a question for Marco, which is that, you know, you saw a tremendous diversity across the EU nations in terms of trust and their particular attitudes, as you showed during the regression. And I wonder if you could talk a little bit about that variation and what you think might account for the differences in social trust, and if there's anything that governments can do to increase social and political trusts in the countries where it might be lagging.
Yes, thank you for the question, Andrew. There's a very interesting point. We're trying to look into this at the minute because we got exactly the same question at another conference last week, which is interesting. So it's a difficult one because we obviously look at 2016 and the world was very different. European Union was very different in 2016. If we think about Brexit, Britain was still in the EU and the political scenario was a lot different before the pandemic in general. So we are inclined to believe that what might have worked in the past is probably not going to be working now. And the landscape has changed a lot in Europe, politically and socially after the Russian-Ukrainian conflict. So if to have just an answer to this, it will be very, very complicated. What I can say, they really need to work on rebuilding a sense of community, to try to understand what the needs of the people are, and it's probably the best answer I can give to you, because I'll say that after the Russian-Ukrainian conflict, after the pandemic, most people in the EU have lost a lot of trust in the government. So if they were to do the survey again, probably the level of trust will go further down. So to reinstate that, they will need to work on the financials of the countries as well, I guess, because with inflation has been crazy in Europe as well, and the political scenario is very fragile. So the best answer the best option would be to discuss this at a common level in the EU, and then try to have some sense of community, and then try to understand what the needs of population might be. And some people are thinking about community groups going to talk to politicians, which has been on the agenda for decades. It never actually happened. They've been trying to do with young people. They're not being really listened to. So I believe to get trust up again, they will really need a change of perspective, which if it's going to happen or not, I don't know.
Yeah, no, the future is uncertain and unwritten. And that leads me to my final question, which is a question for Ife, which is really, your presentation on Majidun was very illuminating and quite devastating, as you sort of mentioned. There's no brighter note. So I'm wondering for you, what you hope to accomplish with this work and with your work more generally. What can a researcher contribute to helping the plight of folks with disabilities in Lagos, or more broadly in the communities in which you hope to work?
So I think the main thing, and this is something that gets clearer and clearer every day, is that this is a population that people are just not talking about or thinking about, even though, you know, people see them every day. I think everybody that I've spoken to that lives in Nigeria is like shocked. Like, you know, people live like in the same city and are shocked to find out that this detention center exists. And it's not like the government is working extra hard to sanitize the PR, it's just that people are not paying attention. So I think that there needs to be more of a spotlight on them. And I also think that there needs to be partnership with them, right? Like working with people that actually have these lived experiences to kind of elevate their experiences and, you know, help them accomplish whatever it is they want to accomplish.
Great. I think you're right that visibility is the first step, that we have to illuminate the challenges and the inequities that are going on before we can start to think about policy solutions. And it's certainly very admirable that you're taking on this work. And so to all of you, I want to thank you for your excellent panel presentations. Your papers were fantastic. I wish you all the best in your future work. And I thank you for joining us today for the conference. Ryan, is there any other final wrap up that we need?
No, but I also just wanted to second that. I really enjoyed each and every presentation, and I learned honestly quite a bit. Ife, I work with the Mandela Washington Fellowship, which is a Department of State program that sends 25 young African professionals. And one of our largest contingents this year will be from Nigeria. So
Yeah.
I actually will look forward to kind of asking them about it and kind of hearing their thoughts and if
Yes.
they've heard of the detention center or not too.
That would be
So
great.
thank you very much to everybody.
Yeah, exceptionally high quality presentations. I wish you all the best of luck in your future. And thank you all for participating. And thank you to our audience for your great attention.
Thank you very much. And we look forward, if you're able to come to our next panel, which will be starting at 2. And then we'll be having our final panel, which is on community engagements. We have a number of different people from both Drexel and then also from external partners. That'll be from 3 to about 4:30. So if you're able to make it, we really
Yeah,
appreciate
try
it.
to join us if you can.
Yeah.
All right.
Thank you very much.
Thank you
Thank you.
all.